Client Teaching, Lactation and Mastitis. Hi there, I'm Nurse Tina. You may be wondering about your new diagnosis of mastitis. Well, I'm here to teach you everything you need to know. Mastitis most commonly affects those who are breastfeeding, but can also occur in women who are breastfeeding and men. Mastitis is an inflammation of breast tissue that sometimes involves an infection. The main cause of mastitis is milk being trapped in the breast. Other causes include a blocked milk duct or bacteria that is entering your breast. If a breast doesn't completely empty when feeding, one of your milk ducts can become clogged, and this blockage causes milk to back up, which can lead to an infection. Bacteria from your skin surface and also your baby's mouth can enter the milk ducts through a crack in the skin of your nipple or through a milk duct opening. Stagnant milk in the breast that does not get emptied provides a great breeding ground for bacteria. The inflammation that occurs with mastitis in the breast results in pain, warmth, and redness. In order to be diagnosed with mastitis, your doctor will need to do a thorough medical exam. The symptoms of mastitis include breast tenderness, breast swelling, the thickness of breast tissue, skin redness, a fever, a paining sensation, or burning while breastfeeding. Risk factors for mastitis are sore or cracked nipples, wearing a tight-fitting bra, putting pressure on your breast while using a seatbelt, improper nursing techniques, being overly tired or stressed, having poor nutrition, smoking, and if you have mastitis in the past previously. The complication of mastitis. If mastitis isn't adequately treated in time, or if it is due to a blocked milk duct, it can cause pus to develop in your breast. This will usually require surgical drainage.
Next, let's talk about the different ways to manage mastitis. Antibiotics may need to be prescribed. They usually run a course of 10 to 14 days in duration. It's important to finish all of the prescribed prescription to reduce the risk of any reoccurrences. Pain relievers such as acetaminophen, such as Tylenol, and ibuprofen, Advil, or Motrin can also help reduce pain. Other ways to manage mastitis are ensuring that you're getting adequate rest and you're hydrating by drinking lots of water, ensuring that you're eating a well-balanced, nutritious diet. Frequent breastfeeding is definitely encouraged because it'll help empty out the breast and reduce any cloggage of the milk ducts. New mother, you are probably wondering if it is safe to breastfeed. Breastfeeding is completely safe and it is actually encouraged. Using a warm compress before and after breastfeeding can promote milk flow and help empty the breast, and it also reduces pain. Breastfeeding while treating mastitis. If possible, do not stop breastfeeding. You can still breastfeed while you're being treated for mastitis. Unless there is an abscess, do not feed on the breast with the abscess. Ensure that you're breastfeeding frequently. Remember to apply your warm compresses before and after breastfeeding. And it's best to start with the infected breast first and ensure it is completely drained. And always ensure your infant is latched on properly. Breastfeeding while treating mastitis, it's very important to remember that you need to ensure that your breasts are emptied after each feeding, so you may need to express by hand or use a pump. If you're not breastfeeding, you'll still need to ensure that you're expressing any milk that may be in the breast. You can also change positions, breastfeeding positions often. You can use a cross cradle, the cradle, sideline, or football hold, and lactation consultant can help demonstrate those holds for you. It's also important to apply cold compresses for pain relief when the heat compresses do not work, but don't do a cold compress before, only after, because you don't want to slow the milk flow. And it's also important that you consult with a lactation consultant to ensure that you're breastfeeding properly and that your baby is latching properly, and your breasts are being drained.
Here are some tips to prevent mastitis. First off, fully drain the milk from your breast while breastfeeding. This can be done by allowing your baby to fully empty one breast before switching to the other breast. Another way is to change the position you use to breastfeed from one feeding to the next. It is very important to make sure your baby latches on properly during feeding. Also, preventing the accumulation of moisture in the breast pads or bra can help prevent mastitis. A way to do this is to air dry the nipple before covering them. This seems like common sense, but practicing careful hygiene can make a big difference. Some examples are washing your hands, cleaning the nipples, keeping your baby clean, or using nipple cream if needed. Last but not least, take care of yourself. This includes eating a healthy diet, staying hydrated, and getting plenty of rest. I know that we have been talking a lot about properly latching your baby when feeding, so here are some tips. Some signs of correct latching include your baby's mouth is wide open, with lips turned out like a fish, their chin and nose are resting against the breast, they have taken as much of the areola as possible into their mouth, they are suckling rhythmically in short bursts with pauses in between, they are swallowing regularly, and your nipple is comfortable within the first minute of feeding. On the other hand, here are some signs of incorrect latching. Your baby's head is not in line with their body. They are sucking on the nipple only instead of suckling on the areola with the nipple far back in their mouth. They are sucking in a light, quick, fluttery manner rather than taking deep and regular sucks. This would all result in milk leaking from the baby's mouth. Another sign is that their cheeks are puckered inward or you hear the clicking noises. You don't hear them swallow regularly, even after your milk production has increased, or you experience pain throughout the feed, or have signs of nipple damage, such as cracking or bleeding, which again increases your risk of mastitis. Now I am going to let Rebecca talk about the different techniques to promote milk drainage and good milk flow.
Hi, my name is Rebecca Baxter, and I want to show you how to use all my massage techniques that I use for blocked ducts and mastitis as safely and as efficiently as possible. So generally what I recommend my patients to do will be to use, before each feed, my three favourite ones to use would be the shimmy shake, juice the orange, and then squeeze the toothpaste. So do them in that order. So we're going to start off with the shimmy shake. And again, if we've got the duct over here that's sore, we're going to go up and down first so we're not hurting the actual duct itself. Then we're going to go across. And then we're going to do the juice the orange. So again, not actually touching the duct that's sore, coming through and going through the other way. Then we're going to do that pectoral squeezing of the toothpaste. And we squeeze out and squeeze out and squeeze out. And then we're going to do that shimmy shake one more time. Now you should find, by the time you've done those three techniques once, coming back to do the shimmy shake, it should feel like you're getting a little bit more movement and it's a little bit easier. So you're going to do that shimmy shake up and down, and then side to side again for about 20 seconds. Now if you do this just before your baby's ready for a feed, and it can be a little bit difficult to get quite ready for the feed if their baby's screaming. So do try and get onto it just as you think your baby's getting close to it, sort of about 15 minutes before. It'll just make it a little bit less stressful for you. So you do that just before your baby's about to feed, and it's just going to help clear everything, get everything being able to move that little bit easier, so that when your baby gets onto breastfeed, they're going to be able to help draw all of that milk out of that duct so that you're not getting such a blockage. Now again, obviously some women may choose not to breastfeed, they may choose to pump instead. Doing it just before you pump is going to have just the same effect. So that's how I would normally do things to get things the most efficient. And then what I encourage everyone to do is to do that hourly after that.
Just to reiterate what Rebecca had said in the demonstration, these are the 3 steps for the massage technique that will help unblock the milk ducts and to promote good milk flow. 1 is the shimmy shake, 2 is juicing the orange, and 3 is squeezing the toothpaste.